Mesothelioma treatment options. Surgery. Surgery is often one of the first treatment options tried for localized mesothelioma. The main types of surgery for mesothelioma are extrapleural pneumonectomy, EPP, pleurectomy, decortication, PD, and resection of a single lung. EPP involves removing the lung, lining of the lung, diaphragm, and pericardium. PD involves removing the lining of the lung and some of the underlying tissue without removing the lung itself. For localized tumors, lymph nodes in the lining around the lung may also be removed during surgery. Surgery can potentially provide the best chance of a cure but is difficult and may cause serious side effects. Radiation therapy. Radiation therapy uses high-energy rays, such as X-rays, to kill cancer cells and shrink tumors. It can be used along with surgery and chemotherapy to help prevent mesothelioma from coming back after surgery or to treat painful mesothelioma growths. External beam radiation therapy, in which a machine delivers radiation to the skin from outside the body, is most commonly used for mesothelioma. Some people receive intraoperative radiation therapy, IORT, during surgery when radiation is given right to the tumor site while the tumor is visible. Stereotactic body radiation therapy is increasingly being used, which delivers very precise high doses of radiation to tumors in fewer treatment sessions. Chemotherapy. Chemotherapy uses anti-cancer drugs injected into a vein or taken as a pill to kill mesothelioma cancer cells. It works by stopping the cancer cell's ability to grow and divide. Common chemomedications for mesothelioma include pemetrexed, cisplatin, carboplatin. Doctors may recommend chemotherapy before or after surgery to try and kill any remaining cancer cells. It may also be used for palliative reasons to help relieve symptoms of advanced mesothelioma. Recent studies have found chemotherapy to be more effective when given before surgery rather than after. Chemotherapy is often combined with radiation therapy after a biopsy or surgery to kill any remaining mesothelioma cells. Photodynamic therapy. Photodynamic therapy, PDT, uses a photosensitizing chemical that preferentially concentrates in cancer cells and becomes activated by light to kill the cancer cells. For mesothelioma tumors growing on the chest wall or lining of the lung, PDT focuses a special type of non-dermal light on the tumor along with the photosensitizing agent to destroy cancer cells while sparing normal tissue. It is usually done along with pleurodesis. PDT may help relieve symptoms and potentially extend survival in some patients whose mesothelioma has spread or grown back after other treatment. Targeted therapy. Targeted therapy uses drugs to target specific cancer cell genetics or proteins that fuel cancer cell growth and survival. These drugs work differently than chemotherapy and tend to work better with fewer side effects. Two targeted drugs used for mesothelioma include bevacizumab, Avastin, and pemetrexed, Alimta, which inhibit blood vessel growth in tumors. Other targeted therapy drug options in clinical trials include inhibitors of the PD-1/PDL1 pathway, which help boost the immune system's ability to attack mesothelioma cells. Some targeted drugs are given along with chemotherapy while others are used alone or after chemotherapy stops working. Palliative treatments. Palliative treatments can help control symptoms and pain from mesothelioma but aren't expected to cure it. Options may include pain medicine, oxygen therapy, nerve blocks, drainage of fluid from around the lungs or chest, intrapleural chemotherapy delivery right into the chest cavity, pleurodesis to stop fluid buildup, radiation therapy for tumor shrinking, PDT for symptom relief, interventions for trouble swallowing or breathing. The goal is to maximize quality of life and comfort by managing symptoms versus trying to cure the cancer. Palliative care experts can work with the cancer care team to coordinate these supportive measures. Squamous cell carcinoma treatment options. Surgery is used to treat early-stage SCC of the skin, in situ and stage I cancers. The main surgical procedures used are excision, Mohs surgery and cryosurgery. Excision involves cutting out the cancer and some surrounding normal skin with a small margin. Mohs surgery precisely removes only the cancer by looking at layers under a microscope until all cancer is removed. Cryosurgery kills cancer cells through freezing. These surgeries aim to completely remove the cancer in one procedure to help prevent recurrence. Radiation therapy can be used for SCC to kill any remaining cancer cells near the surgical site after surgery or to treat cancers that can't be removed surgically, such as those in difficult locations. External beam radiation therapy, EBRT, delivers radiation beams from a machine to the skin surface. Brachytherapy implants tiny radioactive seeds directly into the tumor. Radiation may be used alone or combined with other treatments. It works best for early-stage, non-melanoma skin cancers. Photodynamic therapy, PDT, uses a photosensitizing agent applied or injected into the skin that is activated by light, usually laser light, which kills cancer cells. It's most often used for precancerous skin lesions, thin SCCs, and recurrent SCCs after they have been surgically removed. It aims to reduce future cancer formation at the treated site and improve cosmetic outcomes. Topical treatments, creams or gels applied to the skin surface can help treat precancers and very early-stage SCCs in situ without surgery in some cases. Options include 5-fluorouracil cream, imiquimod cream, and photodynamic therapy topical agents combined with light. They work to kill aberrant skin cells. Targeted therapy, drugs that block cancer-related signaling pathways are being studied for advanced or recurrent SCC. These include EGFR inhibitors like cetuximab that block a receptor tied to cancer growth. The immune checkpoint inhibitor cemiplimab was approved in 2018 for certain types of incurable metastatic or recurrent SCC. These aim to stop cancer progression systemically rather than just locally. Palliative care focuses on relieving suffering caused by cancer and associated treatment side effects rather than cure. It's aimed at improving quality of life for patients with advanced cancer not curable with available therapies. Options may include pain medication, topical creams, radiation therapy for symptomatic lesions, behavioral therapies, and spiritual, emotional support. Surgery, radiation therapy, chemotherapy, photodynamic therapy, targeted therapies, and palliative care are potential treatment options for mesothelioma and squamous cell carcinoma depending on the cancer type and stage. The goals of treatment may range from attempting cure with aggressive local therapies for early cancers, to improving symptoms and quality of life for advanced incurable cancers. A multidisciplinary care team guides individualized treatment planning based on a patient's needs, cancer characteristics, medical fitness, and preferences.